the background of orthostatic tremor is that we don't know what causes it. The good news is it seems to be a non-degenerative condition of the nervous system, as opposed to diseases like, say, Parkinson's disease or Alzheimer's, where you're losing brain cells over time. It does appear to be progressive to a point. When I say to a point, it doesn't sort of progress relentlessly like, say, motor neuron disease and things like that, but most people achieve some sort of level of stability at some point. So yeah, the usual intro I tell people about orthostatic tremor is that there's actually like a standard introduction when you read all the articles. It's a rare, enigmatic condition, words that don't enthuse patients, I would imagine, when you hear you've got something rare, we don't know what causes it. But fortunately, there are some treatments that we'll talk about. And the way I got involved in this talk was I've been researching the effects of certain drugs on orthostatic tremor, one gabapentin and the other one pregabalin, and doing some research studies using this piece of equipment, which you can all have a play with later. It's called a balance platform. And also measuring the signal that comes out of muscle, the electrical signal, and measuring recording those measures, trying to capture patients' symptoms before and after drug treatment. And then I got invited to submit an application for the Nord grant, and then coincidentally met Sue, who was referred to me from another neurologist, and all sort of took shape from there. So what I thought would be good to start off with is just give you a background of normal balance, what it involves, and normal control of human posture and walking or locomotion. Does that sound all right? Just okay. So without getting in too much detail, can we put up the projector? And before I went into detail about all the theory or what we know about orthostatic tremor, I just wanted to mention Sue's received an email from a neurologist, Peter Bain, in London, and he's trying to put together a clinical rating scale. So the problem with measures of orthostatic tremor, I can measure your postural sway on here, and we can record the EMG or the muscle signal, but correlating it with symptoms is not always straightforward. So I've used a quality of life scale that sort of cobbled together from a Parkinson's quality of life scale, and you can use general quality of life scales, but the golden standard is listing down symptoms from interviewing patients and then coming up with the most frequent or relevant ones that impact on quality of life and putting it together in some kind of measurable format. So Peter Bain's trying to do that. So before I go into the classic history and everything, it would be good to actually hear from you guys what the main symptoms are. We just go around. What's the name? 2 or 3 annoying pain? Okay, that's something that's not in the classic description. Who has pain? Why? Is there a diagnosis for it? Is it due to nerve damage or joint problems? Okay. Is anyone?
I fatigue from my muscles shaking.
Yeah.
Yeah. All right. Okay.
Yeah. I've sort of wondered whether because I'm stubborn by nature and don't want to give in to this, is it I make myself stand probably too much. I do stand with a wide stance, and so whether I'm putting stress on my legs and that's creating the pain, that's something I have questioned myself as perhaps what's causing it.
All right, so possibly mechanical, probably not nerve damage, etc.
Yeah.
Yeah, I get pain in the back only from the stance.
From trying to stiffen everything.
I'm twisting at the sink, my legs are crossed.
So does that improve or go away when you sit down or lie?
When I stand properly, the pain in the back goes away.
But if you get pain when you're standing up, does it go away when you lie down?
Yes.
Okay.
My doctor
So all I wanted to do is, this was, I was asking about the relation to posture. It said that most of the symptoms come on when you're weight-bearing and upright, which, you know, again, is the classic description. So I'm just trying to work out which of these get better, or even, you know, when you're relaxed, and which come on when you're upright. So, yep, shaky legs is the one of the old school descriptions of this. Oh, this has been around since, or described in the literature since 1984 by a German neurologist who put it all together and described it properly, but it's, there's been hints of it prior to that.
And when we talk about
Yes?
When I squat down and I want to get up, I don't have no strength in my legs.
Yeah, true. Yeah, I agree.
One is to do with stability. So like I have to sit cross-legged or I'm not stable. So even in a sitting frame, I actually have to cross my legs. Otherwise I feel like I'm not stable.
Really? Where do you feel? Is that in your trunk when you're sitting?
Yep, and I can't, I have to sit cross-legged if I'm going to try and eat, like if I'm at a barbecue. I can't sit with my legs in front of me. I actually have to sit cross-legged to get any stability.
Actually, now you mention that, when I sit on my little chair stool, you see, I cross my legs for stability. I haven't noticed that, but it's true. I think I do too. Yes. Yes.
So, I think probably 100% of patients will complain of imbalance when standing. Does anyone not have that?
We all have that.
But I've never heard this before.
You'll learn.
Really? So, it,
Yeah, so I have to go back on my chair. I can't sit on, I used to be able to sit on the stool, but I actually can't sit on the stool now without something at my back.
and
So
it's,
I've gone from,
and it's,
I've gone from a leg, you know, weight loading tremor to an arm weight loading tremor to a truncal tremor.
so you're saying it's not just some people get an upper limb tremor?
No, I only have it when I'm carrying things with my arms, or if I'm leaning on my elbow, or go into my forearm, or something like that.
Does that get better with
If
medication?
I'm moving, it goes. But, you know, the truncal tremor of my back's not supported now.
Does that respond to any treatment that you've tried?
Yeah, I'm from New Zealand, and we don't have a lot of things of it.
You have gabapentin and Lyrica.
Gabapentin was really expensive, and it didn't really do enough relief symptoms.
Lyrica or pregabalin's the more potent version of it.
I'm on America, by the way.
I'm on left coast.
And I've never heard that.
Which? Lyrica?
Solid, yes.
Oh, sorry, you haven't heard of which?
Lyrica.
Oh, I've been on that for.
That's what
Yeah.
Lyrica.
Yes.
Has everyone heard just randomly jump around here? Has anyone not heard of pregabalin or Lyrica?
I've only had gabapentin and
Wow.
that's what it is. That's
Oh, that's the other disclaimer I have to say. I'm giving general advice, and I don't want to step on other people's doctors' toes. But this is just what I do. And sometimes it works, sometimes it doesn't. All right, let's get back to this. So what else?
Can I make a comment? What I've found is, if I'm standing in a queue, the longer I stand, the further up the body it progresses. It starts in the ankles, it goes up to my knees, then my legs start to tremble, and then it'll go up, and like I was waiting in the hotel queue downstairs, it gets to the stage where I can't hold a pen. I mean, that's as steady as I've been this morning, earlier on, because I was waiting in the queue. It reached that point, and it tends to progress the longer you stand. I'm fine. I grab a chair at my local Medicare office. I pull the chair over to the queue and sit down on the chair and drag the chair along the queue. The first time I did it, they looked very askance at me, but they learned to accept that. And I must just say to them, you know, I'm here because I'm on a disability support bench. My disability is I can't stand. So, but it does. It progresses from there up through the body, and then, and if I get rattled, like I did, it overdoes. Stress increases the tremor.
stress.
Oh yeah, I wanted to get to that. Glad you mentioned it.
I
The
find
impact
that
of
happens to
the
me, I freeze
Yes.
and can't move the legs. The body freezes.
yeah. What do you mean?
Can't move.
You can't move
And you can't pick your leg up, you can't walk in it. It
Is
freezes.
this sort of
Stuck.
stuff?
You literally stuck.
Is that
You can't pick your foot
after a
up
while
in it.
or
If
immediately?
you stand for too long, your legs will freeze and you just can't move. You've got to get someone to hold your arms,
Oh, yeah,
move one leg and move it up.
Should be wow. Mobility.
Primary that first.
Exercise. Well, like, I mean, you've got someone on this hand is saying do this and
But
someone
if
on
it
this
works for
side.
you, then
Yeah, well,
It sounds like my kind of therapy. I'm a very lazy person. Don't exercise sounds good.
When you exercise sometimes, do you find a wearing effect on your muscles though? Yes.
yes, very, very
Yeah.
tiring. And that's
I
that
can't-
night.
When I say I can't exercise, what I mean by that is I need to save today so that I can be available for my kids tomorrow. So if I exercise, I'm not going to be up out of bed. So that's why I say I can't exercise, not because I
I've been
can't
playing
as such,
around.
but
I've been playing around with exercise because I used to be really fit,
yeah.
and I've found if you do anything that makes your cardio really high, then it brings on the shakes really badly. But what I've worked with and spent a lot of time, I'm on Lyrica, which is brilliant. It's worked for me, so I hope it works for you, those of you that haven't tried it. But I just do the exercise kind of half-paced now. So I live in a very small town, so I don't have access to pools and things like that. So I've worked with, just started in the last sort of 10 weeks with weights, and this girl does this training session, all the girls in town go to it, and they do flat out and they run up the hill while I walk. And it really, I've had one bad day and I go 3 times a week, and out of all of the sessions I've done, only the next day was bad once, and that's because I pushed myself too fast because I kept thinking I was who I used to be, not who I am now. So you can exercise, but you've got to play around with the level of your heart rate, how far it can go up before it.
And usually that's just stretching.
Yeah.
Yeah.
So
When you say Lyrica works